I know that there are multiple different types of cancer therapeutics out there in the landscape, which is fantastic. And also that radiotherapeutics is one of those new and emerging areas which are attracting a lot of attention and has a lot of great potential. So can you just give us an overview of the landscape for cancer therapeutics, and most importantly tell us how are radiotherapeutics making a big splash in that landscape?
Yeah, sure. When we look at cancer, we still have north of 10 million people who die a year, right? And so behind cardiovascular disease is the biggest killer. So we're not perfect yet, and we're far from it actually. And but really, the pillars of therapy for a very, very long time have been the three key areas of surgery, cut it out, external beam radiation, which is basically zapping it from outside the body inside the body, and the other one is chemotherapy, poison it, right? And so those were somewhat beneficial compared to no treatment at all, but there's a lot of advancement that we could make. But certainly the developments for many, many, many years had failed us until we started to look at the biology of cancer, right? And then we started to get the developments of things like immunotherapy, which is a breakthrough in drugs like Keytruda. That was a massive breakthrough in cancer therapy when we started to understand the disease, and we started to try and treat metastatic disease as well, because it's very hard outside of some chemotherapy to treat metastatic disease with surgery and external beam radiation, because you can't cut out the whole body and certainly zap it with radiation all around the body from an external beam going into the body. So the new developments that looked at biology were really exciting in the first step. And now, with the development of antibodies and peptides, we've seen this evolution towards targeted therapies. And this is crucial to understand that when it's in the body, it may not be in one site, but broadly distributed around the body, and that we can identify it based on its biology instead of just cutting it out and using blunt instruments like cutting it out or zapping it. And this development has been fantastic, right? So now we fit into that targeted therapy space. And there's two key areas. One is antibody drug conjugates. And it's a complex word, but it's where they use these targeting molecules and a warhead attached to it. It goes and finds the cancer, and it uses a toxin. The toxin is internalized in the cell and kills the cell. And there's been some great developments in that space in recent years with new drugs getting to market. We're exactly the same mechanism. So what we do in radiopharmaceuticals is we have the targeting agent plus a warhead or payload, which is radiation instead of a toxin. So for radiotherapeutics, you can attach to the cancer, but you don't have to be internalized. You can actually kill the cancer still sitting outside of the cancer. So this is a great advancement as far as that's concerned. But in radiopharmaceuticals, you also have the diagnostic. So you can start determining where metastatic disease actually is in the first case. And then once you see it and you image it, then you can treat it. And that's fundamentally the difference. So this is a really opening up a new area of better diagnostics and better therapies, for the outcome being the better treatment of, in our case, children and adults with cancer. And where it currently fits, there's only really two therapies on the market, really in our space, when we're looking at the new targeted therapies and the new radioisotopes. So we have a lot more to do in looking at, not only bettering the treatment in those current diseases and getting new molecules that better treat those diseases, but to go broader. And, barely scratching the surface at the moment of the massive oncology area, really start to make inroads into that 10 million people a year is really, really where we want to get to. So that's our goal. That's our goal of developing these new therapies and using a lot of fundamental science to build new products that better treat children and adults with cancer.